Well, if you were on PrEP for HIV prevention, then congratulations, you have significantly lowered your HIV risk. And bonus time, you're getting tested for STIs probably every 3 months. And it's all covered by insurance. That's amazing. Except that STI testing that you're getting every 3 months is not very thorough. It misses the infections you are most likely to have and infections that can damage your health and the health of your partners. So today we're going to talk about what's typically included in PrEP testing, what's not, why it's not, and how you can fix it. I'm Robert from Shameless Care. Let's get right into it. Now, PrEP is pre-exposure prophylaxis, first brought to us by the great folks at Gilead and the United States government. Both funded it, both kind of co-created it, and it has been a godsend. It has saved countless lives from around the world. Now, anytime somebody is put on PrEP, they need to follow the CDC's clinical guidelines. And here are the recommendations. The recommendations are that every 3 months, someone needs to be tested for HIV. It then differentiates in between 3 months and 6 months, and depending upon your risk factors, what else you should be tested for. But generally speaking, the big telemedicine companies, they are basically sending an STI test to every PrEP patient every 3 months. And I think that's what most health departments and STI clinics and things like that are doing as well. And that sounds fantastic because you're on this miracle drug, and I do mean miracle drug, right? And you're getting this STI test every 3 months. Life couldn't be better. And probably your insurance is paying for all of it, right? Amazing. Here's the problem though. That STI test, generally speaking, looks at your creatinine levels to make sure your kidneys are functioning well. That's not even an STI. I'm just telling you that's typically included. HIV, syphilis, gonorrhea, and chlamydia. That's typically what it covers. Unfortunately, that's not all of the STIs. So we're going to talk about two that are commonly missing, and those are Mycoplasma genitalium and Trichomonas. I'm going to tell you why they're missing, what health impacts they can have, and we're going to talk about if you should get tested for them or not. So let's start with Trichomonas. Trichomonas is the single most common curable STI in the United States. I'll say it again for emphasis. The single most common curable STI in the United States. It is extraordinarily common, and it is not terribly unlikely that you don't have it right now. What is it? It is not a bacteria or a virus. It's a parasite, believe it or not. It's a little parasite that lives in your reproductive system. Mycoplasma genitalium is a bacterium. It's a tiny little classification of bacterium called Mollicuties. I kid you not, that is the name of it. This tiny little bacteria with such a cute name, Mycoplasma genitalium. Not to be confused with like ureaplasma or Mycoplasma hominis. Those are typically not considered to be sexually transmitted infections, but Mycoplasma genitalium, make no mistake, is absolutely a sexually transmitted infection. And basically every provider in the United States feels like it should be treated if it is detected. So those are the two infections we're going to focus on today that are almost guaranteed to be missing from your STI testing panel for PrEP, Mycoplasma genitalium and Trichomonas. Let's begin by talking about the health impacts of Trichomonas, because as you can imagine, having a little parasite living in your reproductive system's not great for your health, right? Trichomonas affects millions of people, and most people have no idea that they have it. This is usually asymptomatic, which is why screening for it is so critically important. It increases HIV transmission risk because you're damaging that tissue inside of your body, causes chronic irritation, unpleasant discharge, painful sex, and in women, it raises the risk of pregnancy complications. In men, long-term infection is linked to a higher risk of aggressive prostate cancer. And I will say it again for emphasis, Trichomonas is the single most common curable STI in the United States. It's far more common than, for example, gonorrhea and chlamydia. Just as treatable, but even more common. Now let's go ahead and talk about Mycoplasma genitalium and some of the health complications of it. Mycoplasma genitalium is one of the leading causes of persistent urethritis in men and a major cause of cervicitis and pelvic inflammatory disease in women. It can lead to infertility, chronic pelvic pain, and ongoing genital inflammation that never seems to go away because no one ever tests for the real cause. It is also increasingly antibiotic resistance, which means treating it can be a little bit difficult, although it's certainly treatable. So why aren't these things included in the PrEP guidelines? Well, that's actually really quite simple. You see, there is an organization called the United States Preventative Services Task Force, and they are a group of 16 people which meet 3 times a year and basically decide all preventative health care in the United States. And they are the ones that create the clinical guidelines for STI screenings. Okay? So, for example, I am a heterosexual male. They feel like I should never be screened asymptomatically for gonorrhea, even though I have actually had gonorrhea in the past. These guidelines are pretty whack, and I can pretty much guarantee you that if you're a sex positive person, you're going to look at them and go, well, those are interesting guidelines. Bless their heart for coming up with those. But when the CDC puts forth something like their PrEP guidelines, they refer back to the USPSTF's guidelines on STI screenings because, of course, they do. The USPSTF is how the CDC comes up with their clinical guidelines to begin with. So that is one issue, is that the CDC is not going to mandate some super aggressive STI screening protocol for bacterial and parasite STIs because it's not in the USPSTF guidelines. Now, the second thing you need to realize is that these decisions may or may not have been made by somebody who spent a lot or a little bit of time thinking about them. Look, I own a telemedicine company. I know exactly how this works. I could begin offering PrEP tomorrow. We have a team of doctors. We have great mail order pharmacies that we contract with, and we have a lab that we contract with, and that's all that you need. So here's the thing you need to understand. A lot of these contract labs that do B2B, like work with my telemedicine company, for example, and others, have PrEP packages that they themselves came up with, and they came up with them to be relatively inexpensive. Therefore, they're not terribly thorough. Did that come down from God? What should be in that PrEP package? No. Somebody at the lab just came up with that. And with PrEP, it's even a little bit more complicated because the telemedicine companies can bill insurance companies 100% because PrEP and it's associated with testing has to be included and paid at 100% by insurance companies. That is a part of the Affordable Care Act laws. And going back to the United States Preventative Services Task Force, I realize I'm getting a little confusing here, but I'm just explaining this. And so the last thing these companies like, well, I won't even name any of them, but companies that are doing a great job of getting PrEP out to the masses and then billing everybody's insurance companies, the last thing they want to do is put in tests that they worry about the insurance companies not covering because they're not specifically mandated in the CDC clinical guidelines, which again, go back to the United States Preventative Services Task Force. Now, the third thing that I have to tell you is that PrEP, let's face it, is primarily for men who have sex with men. That's how the guidelines began. For a while, it was only offered to men who have sex with men. Well, now the guidance has changed, and now it's being offered to men who have sex with women, women who have sex with women, women who have sex with men. Basically, anybody that's sexually active can now be put on PrEP, and their insurance has to pay for it. But these testing guidelines are still clearly directed at men who have sex with men. What do I mean by that? Well, these health complications of Mycoplasma genitalium and trichomonas disproportionately impact women. They hit women much harder because they can silently damage the reproductive system, cause infertility, complicate pregnancy, and increase HIV risk more in women than it does in men. So all of these procedures and testing panels and packages and things like that were set up years ago when PrEP was basically only offered to men who have sex with men. But now it's being given to men who have sex with women, right? Women who have sex with men, women who have sex with women. Anybody who's sexually active can get on PrEP now. And for that reason, it's particularly heartbreaking to me that people go out and get on PrEP. They're getting STI tested every 3 months. And when people get an STI test every 3 months, they rightfully think that when they get negative test results, it means they don't have an STI. That's just how people think about this, right? People will say, I was tested and I'm clean. They never say, I was tested for some of the infections in some of the places. And for those infections and in those places, I was negative. They don't say that. They think they've checked a box, they've been STI tested, and they in fact don't have an STI. But the truth is, most people on PrEP are not being STI tested very thoroughly at all. They're being tested for HIV, syphilis, gonorrhea, and chlamydia. And that's great, but there are more STIs than that need to be covered, in my opinion, for someone to actually know their STI status. Well, I'm Robert from Shameless Care. Thank you so much for watching, and we will talk soon.